Care providers in the confusing world of Rogerian, non-directive, active listening, client-centered, person-centered, and humanistic. Care providers like doctors, nurses, social workers, pastoral care, and community workers had been exposed to all these concepts and words during the course of their training and as they learn and practice their craft after graduation. Usually, we encounter these terms when we talk about foundations, values, history, as well as more practical approaches and protocols to care. Unfortunately, although these things are very familiar to those who have lived through and practiced during the 20th century, to many of us in the 21st century, these ideas, which started during the 1950s, 1960s, and 1970s, sound somewhat confusing and difficult to distinguish from each other. Most of us actually think they're pretty much the same things. And it actually gets worse from 1990s, 2000s, 2010, 2020. Even the instructors or teachers might find them very distant, vague, and confusing. This is especially true in care professions where approaches are becoming more and more modern, scientific, impersonal, directive, and maybe non-humanistic. In an interview 2 years before his death, Carl Rogers, who was at this time very famous already, said, "I am not very happy when I hear the word Rogerian because those who tend to use the term often have a somewhat mechanical understanding of my work." Here he is, very famous. Everybody knows him, and his work has influenced a lot of professions and fields. Everyone probably thought that he was very happy with the way things turned out, but surprisingly, he was not very happy. The way it sounds, he's practically disowning the way some people use his name in his works. Obviously, we don't want to do that, so let's try to figure out what the deal is. Rogerian can actually mean all sorts of things. It's anything related to the work of Carl Rogers. Concepts, ideas, philosophy, psychology, counseling approaches. His work is actually influenced by humanism, humanistic philosophy, and historically he is considered as someone who really pushed for the humanistic approach to psychology and counseling. So what is humanistic and humanistic approach? In simple terms, it's focused on the person, the human being, the subjective experience of each person, and the capacity of each person to make positive, constructive, good, conscious choices in their lives. So the humanistic and humanism in ethics and actually in all areas of philosophy would concern itself with freedom, choice, personal responsibility, autonomy, purpose, a sense of meaning, values. And the general idea is everyone is capable of growing in positive ways as they live out their individual lives. So if this is the case, then all we need to do is provide this individual or person with appropriate conditions so that he can grow well and positively into the good person he was meant to become. So we're thinking growth-producing environments, growth-producing relationships to help people develop their full potential. With these things in mind, we can now go to the three general things which are usually called Rogerian. During the 1940s, Carl Rogers, who was in his 40s since he was born in 1902, thought that since people have the capacity to grow positively on their own, then the most important person in any caregiving or counseling encounter is the person or the patient and not the counselor or the care provider. So he challenged the therapeutic ideas and procedures which were becoming more common and popular during that time. A very active care provider providing advice, suggestion, direction, persuasion, teaching the client or the patient, diagnosing, interpreting, telling the patient or the person what their problems are and what they need to do about it. It is care provider centered and not person or patient centered. So the Rogerian approach of the 1940s says we should stop being very directive. We should stop ordering people around and be more non-directive. It is not true that the counselor or the provider knows best. It is the patient or the client or the person who knows what's best for himself or herself. So the focus should not be on what the provider thinks or feels, but rather what the patient or the person thinks or feels. And this is done by trying to understand, clarify what the person or the patient wants to communicate and wants to say. For the provider to understand what the client or the patient feels about the issue, the topic, or the situation or the problem, the provider becomes a very, very good active listener who tries to understand. And how does he or she do this? By encouraging the person to tell their story, by clarifying their statements, what they meant, by asking about how they felt, by describing the emotions that they're seeing, and by asking the right open-ended questions. This list sounds very familiar because in school they're called the active listening skills. In lectures about communication, counseling, the psychosocial approach, and such. Of course, Carl Rogers didn't invent all these skills. These are the stuff we normally use when we're talking to someone and we're trying to understand what they mean. However, his approach to communication and counseling uses a lot of these things, and so these skills, called active listening skills, became strongly associated with the Rogerian approach. Now, of course, we all know that a lot of problems happen because people don't actively listen to one another. They don't try to understand each other at work and at home. Self-help books, workshops, training programs became very popular when everyone realized that if everyone knows how to actively listen and understand each other, then we'll have better companies, factories, homes, families, churches, organizations, and communities. Unfortunately, almost everything that's using active listening skills and is attempting to be non-directive is labeled Rogerian. Or to put it in another way, if you want to be Rogerian, then all you need to do is to be non-directive and use active listening skills. And that's probably one of the reasons why Carl Rogers was very unhappy. He devoted his entire life and work to the humanistic approach to care and counseling. But it seems like a lot of people are just focused on the mechanical use of the tools and the skills. During the 1950s, he renamed his approach client-centered. Instead of just focusing on non-directive approaches, active listening skills, instead of just gaining insight into the feelings expressed by people. So all this is done in order to provide the patient or the person the appropriate conditions or environment so that they can grow in positive ways, to help them develop their capacities, to make positive, constructive, conscious choices in their lives. In a way, Carl Rogers was telling everyone that it is not the mechanical use of the non-directive method and the active listening skills which are important, but the reason behind using all these methods and skills. During the late 50s to the 1970s, aside from the focus on the client or being client-centered, there is now the focus on the therapeutic relationship or the helping relationship between the care provider or the helping provider and the patient or the client. Carl Rogers and his associates tried to figure out the qualities of the client and provider relationship which helps the client out or which leads to good positive outcomes. The quality of the relationship will determine how helpful the care provider will be. So according to him, if we have a care provider who tries his best or her best to nurture the relationship, shows unconditional positive regard for the patient, shows empathy, understanding, is interested in, asks about, clarifies, empathizes, and understands the patient's perceptions, experiences, internal frame of reference. This kind of relationship with all these qualities will be most effective and helpful. The ideas of Carl Rogers and his works became very popular. It went beyond counseling. It was applied in many areas, including education, family care, business, politics, management, organizational development and behavior, medical care, nursing care, and even international relations and politics. Now, during